Hello and welcome to this episode. My name is Audrey Shaw, the TrueSport Outreach Education Program Lead. At TrueSport, our mission is simple and bold: to change the culture of youth sport by providing powerful educational tools to equip young athletes with the resources to build life skills and core values for success on and off the field. Founded on the three cornerstones of sportsmanship, character building and life skills, and clean and healthy performance, TrueSport aims to partner with extraordinary organizations like the Taylor Hooton Foundation to promote a more positive youth sport experience. We hope you'll enjoy this collaborative mini-series between TrueSport and the Taylor Hooton Foundation on the All Me podcast. And we hope you'll use the information presented by subject experts and world-class athletes to go out and make a difference in the lives of your young athletes.
Hello, this is Joe Trahan, welcoming you to the All Me podcast from the Taylor Hooton Foundation, whose mission is to enlighten the world to the truths about appearance and performance-enhancing substances. As the national leader on this subject, they communicate their educational messages through various methods, including this podcast. Thank you for listening and enjoy the show.
Hi, and welcome to the All Me podcast. My name is Tavis Piatoli, sports dietitian with the Taylor Hooton Foundation, and today I'm going to be your host. Have you ever looked in the mirror and wasn't satisfied with what you saw with your body? Or do you normally think about the way your body feels, or even feel embarrassed with your body in certain situations? With nearly 10 million people suffering from a body image disorder, it can pose a significant impact on your mental health and mood. Can you imagine how this could actually impact the mental health of our youth? In this podcast episode, Dr. Melissa Streno and I discuss the etiology of body image disorder, the signs and symptoms of what to look for, especially for parents and coaches, along with strategies to promote body positivity. Dr. Streno earned a Psych D in clinical psychology and her master's in sport and performance psychology from the University of Denver's Graduate School of Professional Psychology. She is currently in full-time private practice with Lantern Psychology as a licensed psychologist in Colorado. She continues to teach as an adjunct professor in the sport and performance psychology program at the University of Denver. Dr. Streno is a certified mental performance consultant of the Association for Applied Sports Psychology and has consulted with youth, high school, collegiate, elite, and Olympic athletes from a variety of sport and performance domains, including dancers and musicians, as well as those active in a business setting. Dr. Streno, welcome to the All Me podcast. It's a pleasure to have you today.
Thank you so much. I'm excited to be here. Thanks for having me.
This is a really cool topic. We're going to be talking about body image disorders in young athletes and just individuals in general. I know this is a topic that is kind of, I guess, I don't want to say secretive, but in a way, it's sometimes it doesn't get uncovered or at least discovered in some areas. It's funny because I had a parent reach out to me about just some issues they're having. So I'm really excited to learn more about what you have to say and some of the questions that we have for you.
Cool. Well, I'm excited to be here.
All right. So first question, let's learn a little bit more about you as an individual. We like to always have our guests kind of give us a little bit of background. So tell us about your career path. What interested you in the field of psychology?
Yeah. Well, I think sport and athletics is kind of what initially got me going down this path. I grew up really active, loved playing all sports, played through college, and then studied psychology in college. And when I graduated, the sport and performance psychology programs were just kind of coming on the scene. And there was a great one that was just opening at University of Denver here in Colorado. So I did my master's in sport and performance psychology. And when I got to the end of the program, I felt like I had a lot of skills and competency in terms of helping somebody with their performance and mental skills training. But there was a part of getting to know like the person. And as we know, all humans struggle with all sorts of things, mental health issues and body image challenges, as we'll talk more about today. And felt like I wanted to get the training to be able to help them and about that next level, which, ultimately would help them with their performance. So I went on and did my clinical doctorate also at DU and really specialized and kind of honed in terms of my practicum experience and the clients I was working with, and really just gaining as much knowledge and insight as I could on working with athletes who were struggling with disordered eating, body image, eating disorders, and a range of other mental health issues, of course. And then did my internship out at University of Oklahoma, working in their psychological resource for OU students, student athletes, and helping them again with performance issues, but also mental health. And then came back to Colorado, and there was a track at a treatment center nearby that was specific to helping athletes who were struggling with eating disorders who needed to step out of sport for some time to get well and recover. Worked there for a while and decided that that was going to be kind of my path for a while, and wanted to have a little bit more flexibility with my family, and jumped into private practice. And I've been doing that for about 2 years. And so I see kind of a mix. My day-to-day is, sometimes I'm in my office all day. Sometimes I'm traveling within the States or internationally with elite teams and Olympic teams. And then I'm doing a lot of just individual work with those who aren't even athletes, but are just struggling with any sort of mental health issue, depression, anxiety, trauma, eating disorders, etc. So that's kind of my path, and also kind of what I do in my day-to-day. It's no day is the same. Every day is very different, which I like.
Yeah, no, I think one of the things that is really important is when you have a history of working with athletes, you have played sports. I think that's an important thing, just to have that understanding. And I think athletes understand and like to work with people that have a history of working with sports. So I think that's great. You have that combination of background. And that's kind of like leads into my next question in a way. Why are athletes especially of interest to you and the work that you do? Why do you see athletes coming to you?
I think with athletes, there's a lot of risk factors that would predispose them to have some of these struggles that we see more commonly, specifically with the body image piece. And as an athlete, and especially as one progresses and goes to the next level, and we see kind of this bottleneck effect of, physically, everyone is at the same level. They're really high level, they're peaking, they're training, they're getting all the support in the world to physically progress, but mentally, they're going to have struggles too. And so I think the competition, the pressure, the expectations can really be a recipe for some really detrimental behaviors and some detrimental patterns that, we see end careers, we see have real severe medical consequences. And so my goal is to help with the preventative piece, the proactive, preemptive planning of like, how do we support athletes in their career to, first of all, enjoy what they're doing, to go back to when we first started at age 3, 4, 5 and just love being out there, but also do it in a way that's healthy, that's stable, that's sustainable, and that's realistic. And we live in a society and also a sport world where that is, I think, often hidden, that can be a possibility, and that you can be really good at your sport and have a lot of fun and succeed and go as high as you want, and also do it in a way that's sustainable and, like I said, healthy, appropriate. So that's why I love the work that I do, and why I really like working with performers and with athletes, is to help them continue doing what they love, but doing it in a way where they're protecting themselves and they're aware of what risk factors are out there in the unique world of sport.
Yeah, that's great. You mentioned it's got to be healthy. And when I just started coaching my daughter's softball team, 9 and 10, and I just want to make it fun. It's like there's people that want this to be about wins and losses, and a lot of these kids have never played before. And I'm like, look, whether we win or we lose, that's irrelevant. I mean, if we win, great, people are happy. But as long as you guys are having fun, we're getting better each week, and you're learning. That's what it should be about, right? At least that's what I think it should be about as a coach. It should never be about just putting the best players everywhere and winning, and losing, because I think that puts a little bit more stress on some of these kids if you push too much about the victories.
Yeah. I think the irony in that is when they're actually having fun, enjoying, when the team is enjoying each other and they're out there because they want to be, they actually will perform better. Right? So it's not simple. If it were that simple, right, I'd be out of a job. But I think it's important to remember, and especially as a coach, like having fun is actually going to help your team and the individual athletes play better.
Absolutely. Let's kind of talk about a typical day in your life and your work you do. So what does a typical day look like for you, and what types of challenges are you most often helping patients work through?
So now that I'm full-time private practice, so I work with individuals. I mean, obviously with COVID, the last year and a half, I've been fully remote. So virtually working with people throughout the States and then across the world who are, I would say, probably 50% athletes at all levels, really from, young athletes who are just kind of finding their way into the sport world and really liking it, all the way up to Olympic teams getting ready for Tokyo. And so I'll do travel, some of those weeks. That's kind of really just restarted this past February. So I kind of work around the travel a bit, but when I am here, I'm in my office virtually seeing individuals pretty much all day. When I can, in person, I'll do team sessions. So I'll do some work with full teams on more mental skills training, cohesion, just kind of process groups of how things are going, what they feel like could help their team better, can make it more fun, a better culture environment, et cetera. And then with the individuals, it's anything from, mental health disorders such as depression, anxiety, who are athletes, and then also those who are not athletes. And again, working with them on a range of mental health disorders that we would see in anyone too. So it's kind of varied. Challenges, I think, obviously, like I said earlier, with COVID virtually, there's a lost sense of like felt energy when you're with somebody in person versus looking at them through a Zoom screen or through a computer screen remotely. So I really have appreciated more and realized how much I took for granted actually being able to be in person, with someone. I think there's a lot that you can take away and gain from just being in the presence of someone without having to talk. And, remote has made that really hard this last year. Obviously, travel has made it hard. Not being able to be with people in the competitions that have been canceled has brought a whole new level of grief and loss for a lot of the athletes that I work with, just in terms of the unexpected and uncertain schedule changes because of COVID. I think a lot of them have felt like the rug was kind of pulled out from underneath them and no light or kind of projected timeline of what would be next. And so I think this year that's been the hardest thing. I think the silver lining to that is a lot of the athletes and clients that I've worked with have really grown from it and become stronger and really tried to capitalize on like this extra time to get better and tried to make the best of it. And I think that's probably what's helped a lot of them be really successful in their careers already. And then for those who aren't athletes and that, we're working on specifically with body image and eating disorders, this year's been really challenging. I think we've seen with COVID just such a rise, obviously, with isolation. And when we think about body image issues and eating disorders, disordered eating, secrecy, isolation, all of that, loneliness are just such triggers to engage in those behaviors and to have those more intense body image thoughts. And so I've seen a huge uptick in body image negative thoughts and disordered eating. And so that's definitely been a challenge this year, is that there's a huge need for help. And to be honest, therapists aren't having the openings that they did. And so I think, as they described kind of this mental health crisis, I think we are seeing it happen. And I'm seeing it happen in my practice with, like I said, again, athletes and non-athletes kind of across the board. So new challenges and really working with them to try and find like the benefits, the silver lining to getting back to hopefully, a safe and I guess new normal, in these coming months and this next year.
Yeah, I can't imagine how challenging it's been for so many people. I've just personally talking to friends that have seen it with their own children that they struggled with not eating, struggling with body image disorders. And I know we're going to talk deeply into that today, but it was just really interesting that people would call in as a dietitian and like, hey, can you help? And I'm like, this is not really my area of specialty, but let's see where we can get them some help. And that kind of leads into my first question about our topic on body image disorder. What is it? Can you define it and kind of give our audience a little bit of overview about what it is?
Yeah. So when we think clinically, right, body image disorder is not an actual disorder that we see in the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. So that's kind of like our book as psychologists or therapists that we use to code particular disorders, depression, anxiety, obsessive compulsive disorder, et cetera. So body image disorder is not a term in there. We hear it often, though, used because there are multiple disorders that include the component of body image issues or thoughts or concerns or negativity. So I think you've already heard me today mention like body image issues or body image struggles or thoughts. It's a component of these disorders that we would clinically diagnose or that we kind of work under the umbrella of. But when we think about body image struggles or issues, they're often negative and really just distorted thoughts about one's shape, weight, size, appearance, how one's presenting. I don't know an exact percentage or like prevalence rate for those struggling with body image thoughts, but we know very closely connected are body dysmorphic disorder, which is a diagnostic in the Diagnostic and Statistical Manual. So in the DSM, it's an actual disorder, and then multiple eating disorders. We know it's a huge component of both of those. So body image thoughts and struggles is really just the way that one's negative view of themselves or their perception that's really distorted impacts their daily functioning, their relationships, their work, their self-compassion, their relationship with themselves, their relationship with food, exercise, most importantly, their relationship with their body.
Is this a common disorder that you may see in athletes, particularly young athletes today?
Absolutely. there are non-sport related risk factors for developing, really that intense focus and negative view of one's body, but there are definitely some serious risk factors for athletes when it comes to body image thoughts. Uniforms would be one. I think we've seen such I don't know if progression is the right word, a shift, a change in how uniforms are from, even 20 years ago, 10 years ago till now. Transformation, there we go, where, there's just less material being used. So that is absolutely a risk factor that promotes more focus on how one looks. The pressure in the athlete's environment to look a particular way in order to play a position within that sport. So playing goalie versus center, or I'm trying to think of, different positions within a sport can present different body image challenges just based on this perception that there's an ideal to be really successful in that position or within that sport.
It's interesting that you say that about just equipment or just uniforms and the way an athlete or maybe look or perceive that they look in the way they perform. I was in a coffee shop recently, and the owner and his daughter were in there, and she was very open about talking, not to me, but just in general. I can hear her about talking about her weight, and she's like, if I was at this weight, I'd be too skinny, and if I was this weight here, and this would probably be the best weight for me, just to be leaner based on when I look, based on when I played sports. And I was just like, wow, as someone who has a 10-year-old daughter and who's kind of starting to really observe, she's starting to observe the way she looks and feels. And I try to deflect that, that topic right now and not have her even think about body image, but I know it's going to come. It was interesting when you mentioned that. I was like, that just initially brought that thought to my mind that, it's the thought process it starts at a young age, I would think. I know we'll talk about that, but it just made me think of that conversation that was had.
Yeah.
We talked about athletes. It's common, but what's the prevalence, or is this a pretty prevalent disorder in non-athletes compared to athletes?
I think it's in the society we live in, it's everywhere, and it can be expectations in a workplace. It can be expectations within a team, like we talked about. A lot of it stems around like the culture of whatever that environment or that community or that dyad even that you're in, relationship that you're in, and what those expectations are and how much, we give into them to fit in, to be seen for various reasons, right? There's a function for everyone that can, we can think of millions of functions. So yeah, it's common within sport and without outside of sport as well.
Now, do you find that there's a notable difference between populations? Is this something coaches, parents, and athletes should be more aware of?
Absolutely. I mean, I think it's always important to be aware of those risk factors and what one's child or athlete may be predisposed to. And I say that because it could be sport now for some, and it also might be another life realm or involvement later on that takes place, or that takes one to that same place in regards to a very negative self-view or perception of one's appearance. So I think it's really important for people to be aware of, to know kind of what are some of those flags, to be thinking about and looking for, whether that's now in the next year, if it's in 10 years with another athlete or child, friend.
Yeah. I'm noticing, I think this is a disorder that's probably perceived in just the general community. Oh, it's only females, right? Only females struggle with this. And I've had parents call me about their son saying, hey, my son needs to gain weight. And, when I talk to them on the phone, some of these kids are more, and they're athletes. I mean, high performance athletes, 30, 40 pounds underweight, that they're like, hey, I want to get a 6-pack. So in my question, I'm like, wow, well, if we can really get your body and developed, it's going to help your performance more than your physique. But at the same time, I think with that perception, do you see a big discrepancy between the percentage of female versus male athletes who suffer with a body image disorder?
Anyone can develop these thoughts or perceptions of themselves, like you've mentioned and given some examples of. I think it's common for males, for females, transgender individuals, all genders. But I do think more males are speaking up now. And, I don't know if it's, I think it's both and, right? I think more males are speaking up. I think more males are providing a platform to normalize seeking help, which has led us to see an increased number of them struggling. So we're seeing the numbers of males struggling with eating disorders or body image thoughts or body image issues on the rise, but also because I think there's, and I hope this is the direction we're going, that there's, less stigma and more acceptance and more, seeing it as a strength and requiring courage to speak up and ask for help. Because you're right, I think there is this myth that's slowly being, taken down, and that this is only something that women or that females have struggled with or currently struggle with. And that's just not the case. And I think, again, the silver lining is that there's some high level athletes too. And just, I think, people in society that are more visible who are speaking up. And I think that's helping those who are keeping this a secret or doing this in isolation or are worried about speaking up feel like they have a voice and feel like they can ask for help and that they have a community to go to.
Excellent. Yeah. We definitely need more resources for this. And I've just seen it more this year with more people calling, and in certain sports like soccer, boys soccer, it's starting to seem to be very common with this, just that physique and appearance look. As I mentioned, my daughter's 10. I probably noticed when she was 5, she started really just noticing things or making comments about, oh, wow, this Barbie doll or this and that, and this just shape and image. And I was like, okay, where's these thoughts coming from? So my next question is there an average age someone might start to experience body image disorder?
Yeah, I mean, you're right. This is one of the most challenging pieces with this starts so young. As soon as young kids begin to develop this awareness of their bodies in space and in relation to others, it's at a really young age. And I've seen, like you said, really specific comments and comments that signify like a true understanding of appearance and comparison to others at the young age of 4, 5, 6. The society we live in and the relationships we have, I think, with family, friends, classmates, teammates, they play a huge role. And so as soon as we're starting to involve, or as soon as the kids are starting to be involved and start to participate more in these group activities, team sports, school, naturally some of these messages and some of these myths about body image, are going to start coming up. And as we know, kids are just sponges, right? They're going to absorb everything. So caregivers, coaches, teachers can really play a huge role in body positivity and positive self-esteem.
Do you find it more common in younger kids or even in older adults, or is it kind of half and half when it comes to having these disorders?
Honestly, I think it spans from, young, like I said, 4 or 5, all the way up to, I work with people who are in their 60s and 70s who have been struggling with body image thoughts their entire life. And you can imagine, how trapping that has felt for them for years and years and years. So I would say it spans, and there's ebbs and flows and waves depending on particular life events and relationships and, developmental periods that younger kids go through all the way, through college and all of that. So it spans the entire age range.
So obviously there's got to be something driving this, right? There's somebody somewhere, something saying, hey, you don't look the way you should. And there's primary risk factors. So what are some of those primary risk factors that you feel is driving someone to not feel good about themselves and have a disorder when it comes to looking at their body?
Yeah. I think on the more kind of external side, like I said, we live in a world of kind of these presented ideals everywhere that really take away from the significance and I think the importance of one using their mind and their body as the best guide to how they fuel their body, how much they exercise, how much they rest, how they approach and really develop a relationship with one's body. But the messages we get, like you said, through TV, magazines, everywhere these days have these presented ideals that really challenge that and I think make people of all ages second guess their own like gut intuition. So I say that as kind of more the external, but then also within families, I see so many just cyclical patterns that are passed from generation to generation. And, it might be dieting is kind of like the main idea, but as we've seen throughout years, like various diets come and go. And so I see, maybe a mom who struggled with the paleo diet, and then the daughter is doing the keto diet. And, that's just one example of a million things that we could see. But just to kind of give you an idea of like where some of these primary risk factors are, they can be in your home. Like they can be in the everyday routine that, some parents are aware of and feel are really important, and that others aren't aware of too, but can be really detrimental when it comes to really kind of developing, like I said, and maintaining that relationship with one's body. So both kind of on the outside, within society, all of that, and then also like within our homes, relationships, teams, more tight-knit, closer communities too.
Yeah, you mentioned just social media and magazines and TV, and I watch and look at my daughter's phone a lot in regards to just some of the things she looks at. And I can see why some of these kids are just looking at some of these videos and things they see on Instagram and TikTok and things and go, okay, I need to look like this or feel like that. And I know you kind of mentioned, yes, there are pressures probably from what we see on those things, but are there any positive social media movements that you've seen that might potentially help or comfort someone that might be struggling with these issues?
Yeah, I mean, there are, and this this is the cool and exciting thing. And I think, I would say, especially, I feel like looking back in maybe like the last 5 years, I feel like there's been a huge push for body positivity. And again, like really breaking that stigma and using social media as a positive platform. So I think there are great resources. There's groups, there's social media accounts that are promoting that body positivity. I think when we think about the athletic world and sports, a lot of athletes are using social media also as a platform to really kind of shift that message and encourage body positivity. I'm going to think of some examples off the top of my head. The former UCLA gymnast, Caitlin Ohashi, I hope I'm pronouncing her last name correctly. She's always been somebody who really has stood up to body image thoughts and negativity and really promoted that positivity. Mary Kane was a runner. Also Ali Kiefer, really working to encourage like shifting away from, a number on a scale or a size or anything like that. I think these are just a couple examples. There's obviously a lot of males too, just helping to break the stigma and encourage those that are struggling to seek help. And I think it's shifting this from being viewed as a weakness to something that requires strength and courage and something that's really important. And so, yes, I do think social media can be really helpful. It can be beneficial. It can be, kind of that one last piece that helps pull somebody out of, this black hole of being in either an illness of an eating disorder or just, again, in this, kind of tornado of thoughts, of body image thoughts, and help them get.
No, that's really important and really good that we have positive outcomes and positive ways that we can use social media, because when we were growing up, we didn't have any of that. We didn't have any of those opportunities to see as much as what kids are seeing today. And it's good that they have, like you said, that body positivity. I actually had a colleague of mine tweet about it this morning, and I was like, it's good to see more of that being presented on social media. Let's talk signs, and it's especially for parents or coaches or audience that's going to be around kids, or at least their own children as well. It's like, what are some common signs that might indicate someone is struggling with a body image disorder?
Yeah. So I kind of group these or separate these into two groups. So there's the emotional signs that, I think just knowing somebody well, whether that's a caregiver or a friend or a parent, coach. For example, we would think of somebody who's really overwhelmed. I think that's usually number one indicator, like somebody who just has trouble thinking, processing, problem solving, like they're clearly being distracted or pulled away by something else. And it's often just this fusion with how they look, the body image piece, and then what they're doing to either change their body or shift. Any changes in mood, temperament, self-esteem, isolation, or conflict with team and coaches, like just a different way that they're interacting with those that they're around a lot, or with their siblings, with parents, with friends. Anxiety about anything related to weight, so any weight changes or changes in clothing. Noticing that maybe they're feeling out of control. Obviously, within sports, it's helpful to look at, when we're looking at like a decrease in performance or a shift in performance, physical or psychological, asking ourselves, maybe this is one of the culprits or something that's contributing. Rigid exercise schedules, not wanting to be around the team for team meals. Obviously for women, amenorrhea is an indicator that maybe there's actual like physical medical stuff going on as a result of body image thoughts that are leading to disordered eating behaviors. Chronic or overuse injuries we see often related to this. So I could go on and on.
Yeah.
I think, and those would be the physical as well. I know I kind of switched into that without sharing that some of these were physical, but obviously like training when injured or tired, low energy, anybody who's like obsessed with training details, just a noticeable shift about how somebody normally would present, I think would be a good indicator that maybe something's going on, and just that it could be important to be more curious with that person about how they're doing and if they need any support.
Yeah, there's a lot of indicators, as you mentioned, a lot of signs that people need to be aware of. And I know we'll talk about a question I'll have coming up, just when to seek that medical professional. But you mentioned we've been talking about body image disorders. Now, let's talk a little bit about body dysmorphic disorder. What is that, and how is it related to general body image disorder?
Mm-hmm. Yeah, so in the DSM-5, like I mentioned before, body dysmorphic disorder is actually under what we call like the obsessive compulsive and related disorders, similar to like OCD or hoarding disorder, trichotillomania. So it's not under the eating disorders necessarily, but very connected. And what body dysmorphic disorder is when there's this perception that somebody is themselves, the perception of themselves that they're very unattractive or that they're ugly. There's a real intense focus on particular flaws or things that they think are wrong or that could be shifted, and it magnifies, it just kind of grows and grows and grows. And they truly believe that this is true. Like there's nothing anybody could say or do that would shift their mind away from believing that this is the reality, even though it's not. So it's like an extreme distortion of how one looks or how one part of their body looks. It can cause isolation. Like there's a lot of anxiety connected to this. That's why it's under some of these OCD and related disorders, not wanting to be around others, kind of more isolated. And then it can absolutely interfere with their daily functioning and routine. They can be late, they can be missing events, late to training. Like I said earlier, just a lot of worry about what others think, and think that others are really intensely focusing on them as well. And overall, this just creates significant stress and upset, which can lead to other detrimental disordered behaviors. So not just eating disorder, but other mental health struggles, depression, anxiety, like I mentioned, or like a full-blown eating disorder like anorexia or binge eating disorder.
Yeah, you kind of answered my next question, because I was going to say, does struggling with either body image disorder or body dysmorphic disorder, could that lead to an eating disorder? And that seems like that's a pretty high prevalence.
Yes, absolutely. We see a lot of connection there, and especially within sport where there's that intense focus on the body too. And there is, like I said, I definitely don't want to minimize those who are not in sport not struggling with body image, because it absolutely happens and is just as common. But when one feels the need to change because of this intense obsession or this dislike of a particular part of their body, that's when the eating disorder behaviors can come in. And they might also observe others doing this, so it can feel really familiar, acceptable, or like a quick solution. We see this sometimes within teams, kind of those like copying or mimicking particular behaviors that become what we think are kind of like part of the culture. They're team norms. Everyone's doing this, so it must be okay. And it's not. And, some pull out of it and realize it actually doesn't feel that great. It doesn't help their performance. Energy's low, concentration's awful, et cetera. And others get really entrenched and sucked in.
I know we've talked a little bit earlier about just a lot of the different side effects and potential outcomes. And we also mentioned a little bit about, with COVID and mental health, that's significantly on the rise. Mm-hmm. Now, how does struggling with one of these disorders, especially like a body image disorder, how does that impact someone's mental health or well-being?
I think many with body image issues or challenges have eating disorders, but also other eating disorders related to anxiety, OCD, perfectionism. We see a lot of temperament and characteristic or personality characteristics, I guess, that, people are born with. That's just who they are. That's not going to shift. That really contribute orderliness, compulsivity, coachability, perfectionism. There's, I think a pretty good profile of those that we see with similar temperament or personality characteristics. And so that can be a risk factor in itself, and it can become obsessive and anxiety inducing and really impact their mental health and their well-being. And it also can really just detract from the things that we love to do or the people we love being around. We see depression a lot with this, right? Because we start to really lose interest in the things that we normally would enjoy, whether that's in the sport world or not. But I think the things that we kind of centered our routine around that brought us joy and that we were looking forward to and excited about kind of starts to diminish a bit. And it's hard to find things to connect to. Our values, start to feel a little bit more distant and harder to connect to or align with as well.
Yeah, it's got to be really, really tough on these individuals. And especially when we look at, like you said, perfectionism is pretty common in their behaviors and characteristics. Are these individuals that you find put a lot of pressure on themselves versus others?
Absolutely. Yeah. I think, they're never going to do anything perfectly right. So they're just setting themselves up for disappointment over and over and over. And that can be that can be very stress inducing and disappointing, and can contribute to significantly lower moods and also just really low self-esteem, low self-compassion, just this feeling of never being good enough. And that's when we see some of the control around food or exercise impacting body image, right? Like if I can't do all of these things right, this is the one thing that I can control. And so that's, definitely not limited to, but absolutely one of the biggest things that we see with disordered eating and the body image connection is if I don't feel like I'm good at something else, this is one thing I can really, become good at.
Yeah. And I've seen that a lot with just people in general, whether it's adults or children. It's like, and I also read in the book, 92% of people give up on day 2 of trying a new nutrition program or diet because they weren't perfect. And I was like, wow, that's pretty fascinating to know, in your mind, well, if I have a cookie, I'm not perfect. Well, I guess I'm just going to let this day go to waste and not really stay consistent. Mm-hmm. And I see that a lot with clients. Now, we've talked about the COVID pandemic and how that's affected a lot of people with their mental health and well-being. Have you seen an increase in prevalence and just body image disorder, eating disorders in your practice due to the pandemic and the start of that?
Yeah, absolutely. Pretty significant increase. And I think part of it, well, there's many reasons why. I think isolation, like I said, just not having that less accountability from those to hold one to healthy behaviors and choices. And when I say healthy too, I just, as a side note, healthy meaning like, I'm not referring to like clean or any of like the diet culture centered behaviors. I mean, healthy as in like fueling your body appropriately, resting when you need it, making sure that you're getting, the food you need for the energy you expend. So healthy behaviors and choices, it's hard for people to be held accountable when they don't have as many people around, or they don't have those who are kind of helping keep them on track. And it's especially for those who are already struggling with body image thoughts or eating disorders, they're definitely at greater risk. Less community, less interaction, fewer group engagements, especially sport has really shifted. And so when we think about like that joy piece, so there wasn't as much to look forward to. Competitions were being canceled. Eating disorders really thrive on that secrecy and that isolation. And so COVID kind of presented the perfect ideal for that to really manifest and grow. And so, yes, I think we've seen a rise in those who are already struggling with the body image issues and thoughts, but also I think an increased focus on maybe those who weren't before, just because of, like I mentioned, some of those risks of isolation, less community.
Yeah, especially in school age kids. One of the things with COVID, we know in some cases, a lot of kids were virtual. I was very fortunate. My daughter was in person all year from August until tomorrow. Friday's her last day of school. But, I think for those that were virtual, we know that probably impacted a lot of those kids year round. How can teachers and educators help their students feel comfortable and safe in that virtual space, particularly as it relates to like being on camera? So if you have to be on camera and show your face, do you feel that impacts, the mood for some of these kids?
Absolutely. Yeah, I think there's a lot of vulnerability and exposure being virtual, right? You're in your home. I've seen from, students all the way up to professionals, like less desired, to, wearing like, what did I hear? They described it as like power casual, right? So like, yoga pants and just more comfortable clothes. And I'm sure I didn't see a ton of school age kids or, teachers and such, but there's a real shift, right, in how people are dressing and what their appearance is and what they're looking like. So for teachers, really, to create that culture with the kids that includes positive body image thoughts, expectations within the group that really promote that, make it a routine to also celebrate and talk about what our bodies allow us to do. We are so focused, and I think just kind of, consciously are not trained to think about what we wish our bodies could do or things we want to look different. And so teachers can be aware and kind of shift that to some opposite action and celebrate and really highlight the things that we are able to do. I think also making it a really like safe, brave space to process, so that those thoughts, when they do come up, having a realistic, open dialogue about that. And then I think, teachers, like I said, they are such vital, important parts of these kids' lives. And like I said, with parents and caregivers, making sure that what they're saying about themselves, which sometimes we aren't aware of, making sure that they know that kids are hearing that or watching that. And so whether they're talking to another teacher at school or if it's virtual, just kind of saying it off the cuff, that could be the one comment that sticks with one kid and they really take that to heart. So being aware of what you're role modeling as well, I think is really important for the teachers. Just to add one more thing to their plate because they do so much already.
I think we probably had more adults in pajamas for meetings than we had. I've heard so many adults say, I'm just going to work in my pajamas. They won't know what I'm wearing because you're not seeing that. So it's kind of funny.
Yeah, it became the norm.
There's a time where people just need to know, hey, I need to seek medical help for this. It's not something I can control on my own. So at what point does someone need to seek a licensed medical provider to help them with some of their disorders that they're having?
Yeah, I think that's a great question. And, every individual's process is different. Their journey is different. My first, to put it most simplistically, I'm most concerned always when someone comes in and we're assessing what level of care they need or what level of support. I'm looking at their medical stability, which I'm not a medical doctor. So I'm relying on their primary care or sometimes their dietitian they're working with will have labs specific to behaviors they're using. And so as a team, really assessing how stable are they for outpatient per se, which is 1 to 2 times a week, not any sort of higher level of care. And then I'm also looking at safety. So looking at comorbidity with other mental health disorders, depression, anxiety, OCD, trauma. Depending on kind of where they're at, that's where we would decide, this is something that they can maintain in outpatient and we can see how they do with just an increased therapy. I always require somebody who's struggling with body image, disordered eating behaviors, or has an eating disorder, that they're working with a dietitian as well to help them with meal planning and exercise guidelines and the dietary therapy component, which is so vital for this work. If somebody's not able to, let's say, maintain their weight or interrupt purging behaviors or stop themselves from the overexercise that's causing really concerning physical consequences and obviously psychological as well, we would look at a higher level of care. So something like a partial hospitalization program, and then even above that, more intensive residential or inpatient treatment. There's a lot of programs also now that do dual treatment. So like an eating disorder and OCD or eating disorder and trauma. So looking at all the other factors that might be contributing towards the development and maintenance of this person's eating disorder and deciding what level of care and support team is going to be best for them. But kind of coming full circle, medical stability, their safety, and then it also comes down to willingness, right? So it's a little different when somebody's under 18, right? Because they're under their caregiver or parents kind of guide. But for adults, it's a little bit more challenging because you only have so much power and control to help somebody get the help they need if you really think clinically that's the recommendation. And to get well with all disorders, but I think specifically with eating disorders, because there's so much behavior and action step to it, that person has to have a level of willingness. And it doesn't have to be 100% intrinsic motivation. I think external can be really helpful, but there has to be some level of willingness and acceptance to be uncomfortable and to try getting well. And if that's not there, if they're just kind of going through the motions or doing this for somebody else, it's not going to be sustainable. So when we think about putting together a really robust treatment plan for somebody or recommending a specific level of care, I'm also looking at motivation level and where is this person at authentically? How much do they really want to get well? And if not, they have to decide when that time comes. Again, if medical stability is in question, there's other routes we'll take to make sure that they are physically okay. But it can be, it's an extensive process. It's fluid, it's changing. And most importantly, I rely on and appreciate and value team approach so much when it comes to helping somebody seek that level of care and deciding what that support's going to look like.
Yeah, I've seen that with people that I'm very close to, that they've had to go through a whole, continuum of care from a lot of different specialists, from psychologists to the social worker, to the dietitian, to the medical professional. It's important, like you said, to have that comprehensive care model for that individual to have success. I think that's so critical.
Yeah.
Couple more questions we want to kind of dive into is really looking at what can someone do, or really are there steps and practices someone can do at home to start addressing potential or existing body image challenges?
Yeah, I think, working to take space from some of the things that we know. So everybody's going to have different triggers. One of them would be like numbers, sizes on clothing, weight, numbers on the scale, working to kind of move away from the numbers and focus more on listening to what one's body needs instead of fighting it for an ideal. So I think it's even just initially building awareness of how many choices and decisions do we make every day that's based upon what we feel like we should do or what somebody else thinks we should do based on what we authentically know our bodies need or know our bodies don't need. So surrounding yourself with those who do the same too. I think, watching others who you think have a really good relationship with their body and don't struggle with the body image thoughts, maybe as much as somebody else does, can be really helpful. So that support, moving away from numbers, recognizing what your triggers are, and then talking to people about it, not trying to do this by yourself.
Yeah, I know you mentioned the scale, the weight, the body weight, and that was kind of my next question. With those individuals that are struggling, are there things they should just avoid or not do at all?
Yes. I mean, ideally, I try to get people to get the scale out of their house. I have them cut the tags off their clothes. I mean, we go to extreme measures to really make it less of an urge and less of an urge to act on with any sort of disordered behavior. I think with the people they live with too, it's important that they're getting education, knowledge around how to support somebody. And so just conversations about food in general, conversations about appearance, weight, all of that would be really helpful to avoid. Now, realistically, right, is that possible every day and for the rest of our lives? No, but for the time being, I think it can be helpful. And then we can gradually rework and rebuild a more healthy, stable relationship with our body and know how to react differently when we are triggered or when we hear something that could be triggering that's no longer triggering because of the work that somebody's done. I think also too, and this kind of ties into the question you asked right before, highlighting other parts of our identity. So I think we've been talking about body image and this, it's almost as if it's like our entire world, which I think at times it does feel like that. And I know for those who are struggling, it absolutely feels like that. But one of the best things we can do to move away from some of these body image challenges and strengthen that body image is really highlighting like the other parts of our identity that we love, that we're really good at, that we connect to, especially those not related to appearance. Because for an athlete, for example, they are an athlete, but they are not just an athlete. They are possibly a student or a sibling or a daughter, a friend, a pianist. I mean, like there are so many other things that are important in our life. And so focusing on some of the other realms and things that bring us joy can help kind of, I think, minimize a little bit how prevalent this focus on one's body and this physical appearance is.
Yeah, you mentioned, I just remember growing up, my grandfather would say things about people's body, or just family members. If they walk in, it's like, oh my gosh, did he really just say that? Not thinking of how much damage could that do to someone's just mindset. If they say, oh, did you gain weight? I'm like, oh my gosh, don't never say that to somebody. But, and that's kind of my next question as a parent or guardian. How do you support your child if they're struggling with body image? Are there things parents they can do or be cautious of or avoid when discussing those questions?
Yeah, I think that's so hard to constantly challenge those ideals and those expectations and the shoulds that are implied by society or family or school or sport. And, parents are not going to be perfect either. I'm a parent and I have a 2-year-old and a 1-year-old, 2.5-year-old and a 1-year-old. And there are things I've said already that I'm like, oh my God, why did I say that? So I know that it's never going to be perfect and we're going to learn as we go. So giving yourself grace first and knowing that you are not the reason for your child struggling at all, that this manifests from so many different things. And also being aware of the things that you do say. Sometimes those one-liners or those comments or those descriptions or questions, like you mentioned, can really have an impact. So consistent reminders for what our bodies allow us to do is really helpful. Regardless of weight, shape, or size, are so useful, like really moving away from talk about specific appearance. There are a lot of body positivity advocates, media, sport figures that we've talked about already too, who are great role models that to remind and highlight those for your kids too, to kind of like give them an idea of what a healthy relationship with one's body would be. And then, like I said, just being aware of how you talk about and describe your own body, but also how you fuel it. So it's one thing just to talk about it, but like I mentioned, kids are sponges and they're going to absorb any messages or beliefs or actions and behaviors. So really being aware of like what you're doing on a day-to-day basis, I think can be really helpful. And then parents asking for help too, asking, how do I talk about this question that keeps coming up? Or, my daughter keeps coming home talking about this part of her body that she's so unhappy with. Like, how do I address this? Know that you don't have to do this by yourself, that this is a hard thing to navigate. And there's always somebody who could help you and answer some questions around what might feel best in terms of how you address it.
How can parents and guardians be a positive role model for positive body image for their children?
Yeah, I think, being able to be aware of any negative body image behaviors and being able to find
parents and guardians. Yeah.
Parents and guardians. Okay. Yeah. I think like I said earlier, like when they can praise their kids for how strong they are and how smart they are and all these things that are moving away from physical appearance and really really highlighting the things that they're doing really well, the effort that they're putting in, how strong their body is because they're fueling it well. I think from a young age, talking about what specific foods help, what milk helps our body do. It helps us to run fast and helps, to our bones to be strong, all that kind of thing. I think just the positive aspects of fueling our body well and then resting our body, like highlighting the importance of taking a day off, letting your muscles recoup and recover. I think those can be really helpful. And then also, letting kids have kind of their own kind of style in terms of clothes. I think as parents, we often get caught commenting on appearance with clothes or with uniforms, et cetera. And so I think letting kids kind of be the guide and navigate what feels best for them and what they feel best in can be really helpful, and cheerleading them through that, supporting them through that.
My last set of questions involve coaches. I've been around in my 20 years of being a sports dietitian, a lot of athletic programs, working with coaches. I've heard coaches say a lot of negative things about body image, things they should never tell an athlete that probably sparked eating disorders. But first question is, what advice would you give to coaches who, due to their nature in the sport, have to open critical conversations about body weight and or physique?
Yeah, first of all, I just acknowledge how hard that is. Those conversations are really hard, I think, because the coach is always kind of walking this line of like, what's my role? What's my responsibility? And as soon as they notice any sort of concern, trust your gut, trust that instinct, and know that you don't have to have this conversation by yourself. You should have the conversation, with professionals or with people who can help if it's at a more severe detrimental level. I think if they do have to open those conversations, I always say come at it from a place of curiosity, a voice of curiosity, kind of with the athlete versus like you are doing this or pointing things out that you're worried about. I know the intention is not to be demeaning, but it could come across as really direct, and that can incite a lot of shame and a lot of guilt with body image thoughts and with eating disorders and disordered behavior. So coming at it from a very caring, compassionate, curious, like I said, place of, these are some things I've noticed. I'm just curious how you're doing. Do you need support? And knowing that it might have to just be repeated multiple times. You might have to plant some seeds for the athlete to really recognize that maybe this is something that I need to get help for. And now that I know he's aware or she's aware or they're aware, I know somebody I can go to for support. So, for coaches, takeaways, like absolutely don't feel like you have to do this by yourself. Be curious with the athlete. And then if it is something that needs to be expedited, if this is something that you feel like is more severe or physically you're worried about somebody's stability or safety, obviously I would say share this with the athlete. We don't want to blindside them and do this behind their back, but involve the people that need to be involved, whether that's a parent, whether that's a director of the team or club, and then medical professionals as needed too.
We know coaches have a lot of influence of their athletes. A lot of athletes look up to their coaches as, in some cases, almost like parent role models or parental figures. They trust their coaches. They're around them more than their parents in some cases. So if a coach is going to be, a positive role model, what ways can a coach help create a body positive culture on their team?
Yeah, absolutely. I think being aware of negative team body image behaviors or comments or consistent terms, phrases used within the team. That's just, again, like I said earlier, that's kind of become the norm on the team. Being aware of when that's happening. You might hear comments about like food shaming, who can eat the least, judgment, critique, labels about particular foods or how much one should be exercising, just food talk in general, and really trying to challenge that and stand up to it and make sure that that does not become the norm. So as a coach, being a leader to establish a norm of, no food is bad food, or fueling your body appropriately, getting variety, fueling your body for all the energy you're expending, like that kind of thing. Finding positive leaders on the team, so including support staff, but who are really encouraging like that appropriate language and that focus. And then again, like I said earlier with parents, I think just reminders for what our bodies are allowing us to do, especially when we fuel it appropriately. And then building a culture around other things besides physical image, so setting goals and values and other things that kind of pull the focus away or distract away from, I think at all age levels and some more specifically that physical image and what one needs to look like to either start or to play well or to be seen as one of the better players on the team.
Yeah, we know at some point we have to get, or at least for the young athletes, right? If a coach identifies this, we got to inform the parents. Parents want to know. I would want to know if I'm not seeing something of my daughter, or especially if she's displaying some of these issues. So, at what point, when should a coach bring a parent or guardian into that conversation with a young athlete to discuss body weight, body composition, et cetera?
Yeah. Absolutely. I would hope most parents would want to know of those things. And so I would say as early as possible. I think how the coach goes about doing it is the key piece, kind of the delivery. So like I said earlier, really including the athlete in the conversation, saying, I'm worried about you. I'm really curious what's going on, and making it a generalization, so when this happens, so you're not singling this one athlete out, but, when I've seen this before, so normalizing it for them a bit, validating, that the struggles they might be going through, the need for support, and then saying, I think it would be really helpful if we asked your parents, or if we let your parents know and asked, what resources we can get you connected with. And then depending on how the athlete responds, I think inviting them, like, help me be a part of planning this. They can say, I'd prefer, we just talked to mom, or we just talked to dad, or, actually, like, I'd rather go to my grandma first. So any point that they feel comfortable, that's going to link more support, I think is going to give them some autonomy and some independence, that they feel like they're not being, that somebody's not trying to control them or take away their sport or take away their routine or putting them in treatment or anything like that, because that can feel totally scary and really blindsiding. So if there's some collaboration that's possible with the athlete, I would encourage that first. Obviously, there are going to be cases where there's not. An athlete's going to say, no, please, I don't want to talk to my parents. And there's medical concerns that an eating disorder can be a really slippery slope. So it's not like we always have time on our side to kind of wait and see how things happen. I always want to err on the side of caution. And if there's any concern, I would just share that with the athlete. Again, normalizing it. When this happens, this is, these are the steps that I have to take because I care about you. I want to support you, make sure that you're okay. And hopefully you are. And we went above and beyond what we needed to do. But in the event that you weren't, I would hate to look back and wish I would have gotten you support sooner.
Yeah.
So I think those are, a couple ideas in terms of those conversations, but every conversation is different and they're just hard to have for sure.
Awesome. Last two questions, and then we're going to do something really quick that's going to be fun. In your opinion, I know we talked earlier about just when do we see these things start at what age, but is there an ideal age or developmental stage that an athlete can better navigate conversations around body image and nutrition?
I mean, I say as early on as possible, role modeling that positive and balanced relationship with one's body, proper fueling, resting, and, as needed, I think is really useful. It prevents any sort of confusion. If there's one thing role model early on, and then there's some big switches, they're going to encounter that anyway throughout their life with diet culture and all these recommendations to, try out or engage different diets and different ways of fueling their body. So if there's a consistent base from the start, I would say that's the best way to go.
Last question really kind of circulates around sports with weight classes. There's certain sports that really focus on body weight, body image. Wrestling is a sport where there's different weight classes, powerlifting, rowing. In your opinion, should youth sports have different weight classes?
That is the hardest question of the day by far. I think there's a fine line. So I think I don't want to take away from the tradition and history of sport. We don't want to change the sport. And at the same time, if the weight classes and the pressure to fit into a particular weight class or to cut weight, if those behaviors are unsafe, detrimental to someone's medical and mental health, then I think it's worth considering if that sport's appropriate for that person. So I think it's okay as long as the weight classes are, used and, approached in a healthy way, in a stable way. I do wonder, and I just don't know enough about the youth sports that include the weight classes, like at very young ages, like when that actually starts. I don't know like what age that actually starts, but I would be curious if there were some more general guidelines and would probably support that, because I think anything to move away from a focus on a number or weight at a young age like that would be helpful.
Yeah.
So I think it's a balance of, keeping the sport as is and that history and tradition, of course, but obviously any sort of medical or psychological, instability or safety issue because of those weight classes, I think would need to be addressed. And unfortunately, we're seeing a rise in that. So I don't know, at some point, maybe that will be the solution and the recommendation.
Yeah, when I was young, I played Little League football, at least not very long, but 6 and 7, and the weight limit was you couldn't be more than 75 pounds, right? It's like it's football. Usually it's a sport where kids can be a little bit bigger, but I was 77 pounds, and at 6 or 7 years old, I'm running around the park, spitting, not drinking water, trying to wear a trash bag so I can lose 2 or 3 pounds just so I can play in the game on Saturday. So I'm just thinking, you mentioned what age. Wrestling, in some cases, I have friends whose son started wrestling at 8 or 9 years old. And I'm thinking, if you're restricting food and just for them to make a weight class, that is just absurd at that age. Now, I also realized we can't have high school wrestlers at 250 pounds wrestling kids that are 120 pounds. That would just give them a significant advantage. But you're right. I mean, we cannot have these extreme measures. And some of these sports, they've done a better job of putting certain restrictions of how much weight someone could lose in a week, how much body fat, they have to be at a certain place, but it still needs to get a lot better.
Absolutely. Yeah, I agree.
All right. We have what's called curveball questions. These are questions that you have no idea what I'm going to ask. Now, the good news is they have nothing related to today's topic. These are just fun questions 3 questions real quick that I think are fun, but just, you don't know what they are. So it's put you on the spot if that's okay.
Cool. Okay.
All right. I'm a music junkie. I'm fired up because concerts are coming back. I have tickets to see some of my favorite bands. So I play music, and every guest I have to ask them this question because I'm just curious. But if you could be the lead singer of any band, rock band, or any band that you like, who would that be?
Oh, top of mind, probably because it was canceled during COVID, was the Lumineers. And I am just like dying for them to be back in 2022. So that would probably I think that would be such a fun group to be a part of, and the places they play at. I would love that.
Well, and you're also close to one of the venues I am dying to get to is Red Rocks one day. So it's on my list. I wanted to see Rise Against there 2 years ago, but I think everything got kind of canceled. So I'm looking forward to that. Okay, if you could have dinner with one person, whether they're alive or whether they're no longer here, who would that be?
Probably Michelle Obama.
Awesome. Last question. If you could have one superpower that would change the world, what would that be?
A superpower. Oh man, that would change the world. This is a really hard one. These are curveballs.
This one I just thought of while we're on. I was like, I changed it up. I was like, let me throw this one at her and see if she can get it, or at least see what you would say.
Superpower that would change the world. Oh gosh, probably some sort of like instant medical cure for something. Yeah. Oh,
I know it's a tough one because there's really no right or wrong answer. It's like there's so many things we can probably say that could make the world a better place, whether it's making them healthy or changing the way people think. And
maybe mind reading. I guess in my field, that's obviously something I can't do. But if I could read minds, I feel like I could probably help people maybe more proactively or preventatively. Who knows? That would be kind of fun.
Well, you'd have a million people waiting outside to just like, if I had a tool that could let someone know, hey, you need to stop eating right now, and then you're going to hit your calorie goal, and you're going to, reach, accomplish, whether it's weight loss, weight gain, whatever that person's goal is. If I had that tool to develop, I would be the same way. Everyone would be calling me saying, hey, I need to see you for this magic device or magic assessment tool you have. So
absolutely.
Dr. Streno, thank you so much for your time today. Incredible information, incredible podcast. We're really honored to have you on the show and hope to have you back at some point.
Absolutely. Thanks for having me. This was great, and look forward to listening and participating in the future.
No problem. Have a wonderful day. Thank you so much.
Thank you.
Well, that's it for today's show. Thanks for listening to the All Me podcast from the Taylor Hooten Foundation, a nonprofit organization leading a national campaign to enlighten people to the truths about appearance and performance-enhancing substances and inspiring people to live and compete without the use of these substances. Please be sure to subscribe to our podcast and tune in to our next episode.